Please join me in welcoming State Representative Nima Kulkarni from House District 40 in Kentucky, which is Louisville, Kentucky. Welcome, Representative Kulkarni.
Thank you so much for having me.
Thank you. So I'm wondering if I could ask you some questions about COVID-19. Specifically, how has it impacted you and or your community?
So it's been kind of a roller coaster, as I'm sure it has been for every other state, kind of looking at numbers and where they are on a day-to-day basis. Kentucky as the state initiated some early kind of shutdown procedures, suggestions, so that we weren't in a really restrictive shutdown, but our numbers were looking good. We were kind of a model, in the country. And then we started sort of slowly reopening, and now we're seeing kind of a spike right back up. So I think what we're seeing is a lot of folks that sort of quarantined for several months, and then now there were folks that were like going to pools, and they're back in athletics. And so there's just been a weird disconnect between what were we supposed to do? We sort of relaxed, and now we're supposed to do all of that again. I think one of the things that's been a result of this sort of up and down is folks getting tested a little bit more in communities that weren't previously tested. So there were a lot of older folks being tested initially. At-risk folks were going to be tested. And now we're seeing, for instance, in our Hispanic community, more of those folks are being tested in this time around. And so you're seeing now the data that they're actually being tested positive at a higher rate. So I think what we're seeing is initially we thought it was just one group of people, but now it's a much more expansive group of people that are being affected, and that's kind of a wake-up call, I think, for a lot of people that thought we were on our way to the other side of this.
So can you share some of the policies at the local or state level that you've seen that have worked, or some policies that haven't worked?
Yeah, absolutely. And as I mentioned, some of the policies that we implemented right in the beginning worked really well. So there was a lot of information being put out every day. So our governor had press briefings every single afternoon at 5, essentially telling people to, social distance, wear a mask, stay home, don't go out, don't go into crowded gatherings. And we saw that worked. We saw that our numbers were not looking quite as bad as some other communities that were not implementing these measures. And it's a little bit different here because we've got a Republican-controlled legislature, but a Democratic governor. So, a lot of folks were expecting pushback, but I think people worked together because they were trying to figure out the parameters of this virus. And then we started seeing a lot of pressure to reopen our businesses. Small businesses are hurting. We are destroying the economy. And it's some of the same stuff that obviously other states, other communities also have been going through. And so we started relaxing some of those guidelines that were put in place. And so now we're back in the upswing in number of cases that are coming back positive, and the number of deaths per day. And so what we have seen, I think, hopefully what we can clearly see that the data shows is that if you follow the guidelines as much as possible, if you push the public and a community to follow the guidelines as much as they can, make sure that everybody feels responsible for their neighbor in terms of wearing a mask, keeping distance, making sure that you wash your hands, all of those basic guidelines, that you can, in fact, curb the spread of this virus, versus going to this rhetoric where it's just all about the economy. I mean, ultimately, the economy is jobs, right? And jobs are people. And if people are dying, then you're not going to really be safeguarding anything in terms of economic prosperity in the future. So I think some guidelines that were successful were making sure that the public knew what the current health guidelines were for safety, how to stop the spread, making sure people were kind of pushed every day to follow those guidelines. And I think some of the bad policies or lack of policy was basically just not following that as strictly and stringently as we were doing.
What will it take to restart the economy in Kentucky?
Yeah, and I think obviously again this is probably something we're going to hear from other states as well. But in Kentucky, you know, we've got our biggest industries are bourbon tourism, for instance, horse racing. So the Derby was postponed until September. We're not, you know, it's supposed to be taking place, right, with people and the whole thing. They just moved it to September. You know, but again, one of the things that we have to understand is this virus, until there's a vaccine, until there's some level of immunity within the general population, this is something that we're just going to have to live with on a day to day. Like, if you want to go back to school, if you want to go back to work, if you really want to reopen the economy, then these guidelines that we were pushing earlier, I mean, they have to become mandatory, and people have to be responsible and follow them. Um, I think I think that's something that we have to come to terms with. I mean, I think people are still thinking there's an end to this soon, you know, in a few weeks or a few months, and I don't see that any of the health guidelines or any of the information that we're getting from other countries is showing that trend. So I think if we do want to reopen the economy, we're going to have to really, really be individually responsible for making sure we follow the guidelines and everybody else in our family and our community follow the guidelines, so that we're not unnecessarily putting people at risk and spreading the virus.
So according to Stop AAPI Hate, there have been over 2,000 hate incidents against Asian Americans in the wake of COVID-19. What have you seen in Louisville or in Kentucky?
It's a lot of the same kind of rhetoric, where the virus originated in an Asian country. So there's this resurgence of anti-Chinese, anti-Asian sentiment, and it's something, you know, I'm an immigration attorney, so one of the three tropes that keeps being brought up is, you know, immigrants steal jobs, immigrants are criminals, and then immigrants bring diseases. And this was something that this is something that's been repeated, you know, over and over in this country since the 1700s. And so we're seeing a resurgence and an acceptance of that kind of language, because what we are hearing is that, you know, you hear things like the China virus and, you know, Kung flu, and just these just terrible, terrible kind of statements and the rhetoric that is basically trying to isolate Asians as the cause of this virus. And so it's okay to lump, again, all Asians together and blame them for shutting down the economy, for all of the deaths that we're seeing, for all of the sickness and our healthcare system being overwhelmed. And if we're not careful, that will obviously result in more violence rather than simply rhetoric.
Worldwide, people have seen the death of George Floyd and the resulting protests about Mr. Floyd and others. So how has your community and how has Louisville reacted?
Right. We are in a very, very tense situation in Louisville. There are protesters that have been in what is named Jefferson Square Park in downtown Louisville, has been renamed Injustice Park, in honor of Breonna Taylor. So in Louisville, we have the shooting death of Breonna Taylor by police officers. And a lot of this seems to have come all at once. So you have George Floyd, you have Breonna Taylor, you have all of these different Black people being killed, with, you know, for no reason, essentially, where it's not something that they were committing a crime. They weren't, you know, it's just a lot of distrust with the police, a lot of division and strife in the community, and it's all been for all of the Black people that have been killed without justification. And so what we have seen is Black Lives Matter protesters. We have seen individuals who are white allies, who are Asian allies, from all over Louisville, and really these protests are happening all over Kentucky, even in smaller rural communities, who think that this is something that they have to speak out about and protest and bring awareness to and attention to. And I think it's an inflection point for that, because there's just been over and over and over, one after the other, in different states and different communities, but the pattern is striking, right? And it's something that I think people are recognizing and are not accepting anymore. So it's been very difficult. There are divisions now between our police and the community. Recently, there has been some strife between the Black community and immigrant community. There's strife between just geographic neighborhoods and older folks and younger folks, and how do we reconcile generational maybe racial bias that exists. And on top of that, you've got COVID still kind of raging in the background. And so you hear a lot of, well, I have to wear a mask and you want to infringe on my freedom, but these protesters are running around without masks and they're looting they're ruining the economy. So these questions of the economy and COVID and health guidelines are all being rolled into this my freedom versus your life, basically. And it's something that has caused a lot of self-reflection for a lot of people in the community and as a city and a state as a whole.
The current COVID-19 pandemic and Black Lives Matter movement has changed the state of the world drastically. What do you think is required of the United States and of the world going forward?
Right, that's a big question. And the word that comes to mind is unity. I think what we have seen as a result of Black Lives Matter, the protests and COVID-19 is just everything that Black and brown people have been living, Asian, everybody, any racial disparity, any economic disparity, any kind of discrimination that's ever occurred, all of that has come to the forefront because of this pandemic. So if you're poor, you're less likely to be able to access the testing and healthcare that you need to fight the pandemic. So if you're more likely to be exposed to it because you have to go to work versus somebody who's in a different economic bracket who has the choice to work from home and the ability to work from home. So you see a big difference in terms of just economic disparities. You see disparities in terms of how the virus is affecting Black and brown people versus white people, in terms of how they're exposed, when they're exposed, and how quickly they can get treatment. Again, a lot of this might be geographic. So we've got testing centers, and we've tried to focus testing centers in Louisville to make sure they are in the west end of Louisville, which is predominantly African American. And also, because there were already some set up in the East End, which is predominantly white. So, you want to make sure that the way that you handle testing and care makes it possible for folks from different communities to be able to access it easily. In terms of just food and water and basic supplies, you saw that as well when the pandemic hit. You had a run in grocery stores, and everything was kind of bought up. And if your grocery store doesn't stock the same kind of things as somebody else's local Costco might, you again don't have access to some basic supplies like soap. Toilet paper became a big flashpoint, and I'm laughing, but it's a serious thing. So I think what we have to understand is that recognizing these disparities is a first step. But in order to reconcile any of them, we have to do it together. And that includes making sure that we understand that we are responsible for protecting our neighbors, our family, by wearing a mask. We are responsible, for not exposing communities unnecessarily because we feel our freedoms are impinged upon. Everybody basically has to be on the same page if we're going to get through either the underlying reason for the Black Lives Matter protests or the COVID-19 pandemic. So there is no way that we can move through either of these crises, which are now intertwined and just all conflated, without everybody working together to make it through both of them. And I think it's an inflection point for a lot of different areas. But again, the only responsible and the only objective way that we can do this is by making sure we do it together. That is not a concrete solution. I just know that whatever the solutions are, they have to be implemented together.
Thank you. What are the overall challenges you anticipate for the legislative session next year in Kentucky?
Yeah, so the legislative session in Kentucky starts in January, and right off the bat, we are going to have to figure out how to reconcile this budget shortfall. So we don't have one for this year, but given the way the economy is going, and if we have to keep shutting it down and shutting it down even more in the next few months, what we are going to have to deal with is a loss of tax revenue, right? A loss of revenue on every level, which will result in budget cuts. We have had years and years of budget cuts to the exact social services that we actually need right now. Safety nets. We need folks to be able to access this. They need financial assistance. They need food assistance. They need assistance, to get to a doctor, make sure the doctor isn't charging them. Insurance. This is affecting every aspect of our citizens' lives. And what we have to understand is that's not going away. I mentioned before, this is not going to be gone in 6 months' time. So we have to be ready to help those who need it the most and not just leave them behind, which is essentially what our budgets have been doing, because we've been cutting education, we've been cutting social services, we've been cutting mental health, healthcare services, and so that's something that we have to really take a hard look at, because you can't just cut all of those and expect people to survive, and so that's going to be the hardest challenge. Given the fact that there's a lot of rhetoric going on right now, it's hard to gauge what that's going to look like, because it's an election year, and so everything is much more heated in terms of sides and partisanship. I think maybe in January, once all of that has at least died down a little bit, there will be a lot more real dialogue between parties and between different groups, different stakeholders, and I'm hopeful that we can come up with something that will be the best solution for our citizens.
Thank you very much, Representative Kulkarni, for joining us today.
Thank you. Thank you for having me. It's good to see you.